As the monsoon rains intensify across Bangladesh, along with high humidity and heat, there are fears that dengue fever outbreak will get worse. NAZMA AKTHER had to rush her 11-year-old son to a private hospital because she couldn't find any accommodation in a government-run hospital, a medical emergency increasingly becoming common across the country.
After he was diagnosed with dengue, within a day we rushed him to the hospital after he was going into shock. His blood platelet count dropped to a critical point and he had very low blood pressure. He is now recovering very slowly.
But many here can't afford to take their children to a private hospital.
The government should take more steps to eradicate mosquitoes. It's just not adequate, and city corporations should take more steps to keep things more hygienic and clean. I had to break my savings bond to pay the hospital expense.
The World Health Organization is calling on Bangladesh to control its mosquito population and minimize people's exposure to the mosquito-borne diseases. The increase in dengue cases is causing alarm among people in Dhaka and other places, and doctors in many hospitals are struggling to cope with the rising number of patients. MUNIR HOSSAIN is a physician who says this outbreak is unlike his seen before. There is now an increasing number of children who are getting admitted to hospitals with fluid buildup in their vital organs, causing refractory shock and eventual death.
This time the dengue situation is very critical, unlike before. Both the doctors and patients are facing much more challenging clinical issues compared to previous years.
The World Health Organization is also warning cases of dengue fever worldwide could reach record highs this year, partly due to global warming, and that half of the world population is now at risk of contracting dengue. In Bangladesh, experts say erratic weather condition and poor drainage and sanitation are partly to blame for the rise in dengue and have urged the government for more coordinated and efficient response to deal with the crisis. Tanvir, Chowdhury, Jazeera, Dhaka.